my name is Ashley Ashbucker and this is my IV pass-off. So I'm going to pull up the record and see that we need to do an IV for some fluids on my patient today. So I'm going to go ahead and go to my patient's room, gather my supplies. So knock, knock, knock. Hi, my name's Ashley. I'm your nurse for today. I'm here to do your IV. How are you? Good. So I take the supplies over to the bedside and I'm going to verify my patient. Do some hand hygiene. Can you just verify your name and date of birth for me? Thank you so much. And I do see on your armband that does match. So we're good to go. We shut the door, we pull a curtain if there was one. So it looks like we need to give you some fluids today, and we're going to do that by an IV. Before we begin, do you have any allergies to latex, any ointments or anything like that? No? Okay, perfect. And do you have any concerns about getting an IV today before we begin? No? Okay, great. Well, we'll walk through it together and you just let me know if anything comes up. So before we begin, I'm just going to set up my supplies and make sure that we're all ready so that we can just make this as smooth and as quick and easy for you as possible. So I'm going to go ahead and set up here. We've got a garbage can, sharps container, okay, so we're going to just make sure we have everything we need before we begin. Open up. Our tourniquet. Some tape ready to secure the IV. Okay, we've got some cleanser. We don't need those gloves. I'll use these ones here. Tagaderm. Okay, perfect. So we should be good to go. I'm going to go ahead and just get my gloves on here, and we'll look at your arm and find the best vein that we would like to use. Wow, it looks like you have really good veins. Perfect. That feels great to me. Okay, so we're going to go ahead and get this tourniquet on. It's going to give your arm a hug. It's going to be a little bit tight for a minute. There's already a pad placed underneath the arm, so we won't need to worry about placing one there, but I would put one if there wasn't. Oh my gosh, and of course I can't put my tourniquet on. Oh, today is being tricky day. Okay, wow. You know what, we're gonna, third time's the charm. I'm a little bit nervous here, sorry guys. Pull it tight. Tuck it through. There we go. Okay, does that feel okay to you? It is tight. You do have a good pulse still, so I think that's gonna be good. Okay. So, we're gonna go ahead now and clean the area. We'll keep this area clean and we're going to allow for it to dry before we begin. While that dries, we'll go ahead and set up our other supplies here. Just get this open. Okay, and then it's important that we prime our tubing here before we start. So we're gonna go ahead and just clean this with an alcohol prep pad. Just get this nice and ready. Okay, that has been primed. All right. Okay, so we're about to begin. Do you have any other questions for me? We're just gonna go ahead and insert the IV into you, and then we'll rinse it out with some saline, okay? Okay, perfect. So we're gonna go ahead and we're gonna do bevel side up for this IV. This has dried. So you would insert it. Until you see flashback, which I do not, of course, and that's okay. We'll go ahead and remove this into the sharps and get another one. And let's go ahead and try this vein here. So, get another alcohol pad. Clean this one. We'll let that dry. We're not going to wave it off or anything like that. You're being so patient. Thank you. You're doing a great job. Okay. We're going to let that dry. Okay. We're going to hold it. Bevel side up. Flashback. Hold that there. Remove this into the sharps. Take this and secure it there. And then we're gonna go ahead and pull back. Release our tourniquet here. And you're gonna check back for blood. Looks good. You're gonna flush it 5 to 10, making sure that you don't let it move. Okay. And gotta make sure we're on there tight. Okay. And it's not flushing and we are kinked, so I think we would need to start that over again. So we don't have another supply, but to avoid that, you would hold it in place. Once you have flashback, you would draw it back, flush the IV with 5 to 10 saline, and then you would secure it. And you would secure it with your Tegaderm. And then you would go ahead and remove this. And, oh my goodness, it's pretty stuck on there. Okay, so you would lock this. And go ahead and just secure it here, close to the IV, but enough to make sure that it's comfortable. You put a lock on there if you have one, and then you would also label it. We don't have a label in our kit. There wasn't anything to wipe up here, but you'd wipe up before you put the Tegaderm on. So now at this point, you can go ahead and clean up your supplies and document what you've done. again, I would have restarted with another needle and gone through that whole process again. If you aren't able to pull back blood, you need to do a new one. So that's what I would have been able to do. And then just get everything documented and cleaned up. You're gonna check the site for any redness or inflammation, check with your patient. Are you still doing okay? Perfect. So I'm gonna just check on you, and we'll make sure that anytime we access the IV that we can administer saline and that's flushing well. And we'll just check back. So we get the patient back into a comfortable position. This was a good position to do the low semi-cavaliers position. They're in the lowest position, so I put up the bed rail, clean up my slides, go document, and call it good.